Hello, my name is Mcculley. I'm a consultant plastic and reconstructive surgeon with a special interest in breast cancer surgery and breast cancer reconstruction. And I'd like to talk to you about DIEP stroke tram flap reconstruction, in other words reconstructions using your tummy. There are two ways of doing this, either keeping the tissue attached with what we call a pedicle tram flap, although my preference is to do this as a free flap or a microvascular flap. That's where the tissue is actually physically removed, and with some very modern technical fancy plumbing, the blood vessels are reattached in the chest and then the skin and fat reshaped into the breast. There is no doubt this operation has many great advantages. Because the tissue is alive and soft, it really probably is the best like-for-like swap of your own breast tissue, and therefore this sort of reconstruction does have the ability to create a breast that feels very soft, very natural. It can put weight on, it can lose weight, and therefore it's very good at matching the opposite side over time, and therefore there's very little need for revision over time. The downside is that it's a big operation, and in my hands this can take anything between 3 and 7 hours depending on the complexity of the surgery. You're left with a scar from hip to hip. That's a bit of a double-edged sword. On the one hand it gives you a flatter tummy, but we do sometimes have to interfere with the muscle in the tummy, and that can cause a bit of weakness, a little bit of bulge, and even very rarely a bit of a hernia. The other downsides of this is that although it's now very reliable with about a 98 to 99% success rate, it can fail due to the complexity of the microsurgery, and then you end up with a scar from hip to hip, albeit with a flatter tummy, but now you end up with no reconstruction. More common, but less serious, is you can end up with some slight differences between the two sides, some firm lumps within the breast, and as I've already said, you may end up with some problems on the tummy, like a wound healing problem or a variable scar on the tummy. There's no doubt on the whole this can be a fantastic operation in terms of potential outcome, but it's also a big operation with potentially big complications, and therefore it's important you decide what's right for you. The operation can be done at the same time as your mastectomy or at a later date. Now the difference between the DIEP flap and the tram flap is that the DIEP flap takes no muscle away, whereas the tram flap has to take some muscle away. That is the only difference. Otherwise it is the same operation. The less muscle we take, the quicker your recovery and the less impact on the tummy. In my hands we do a DIEP flap about 80% of the times and a tram flap about 20%. Whatever your decisions are about breast reconstruction, I wish you all the best.